Welcome back to my stand-up channel. The Vaccines Minister has not denied that firebreak restrictions could be implemented in the October half-term if COVID hospitalizations remain high. Nadeem Zahawi said he hoped the booster program for jabs would prevent the country from needing to go back into lockdown. However, he warned that the one-way road towards sustaining the opening of the economy will only happen if we do that well. It comes after the newspaper reported that the government is planning October firebreak restrictions if cases surge after schools reopen. Speaking to Kay Burley on Sky News, Mr. Zahawi did not confirm or deny whether he would endorse the measure. He said the booster program is his absolute priority, as it will absolutely help us to transition the virus from pandemic to endemic status. He said, "That will protect the most vulnerable to serious infection. That will absolutely help us to transition the virus from pandemic to endemic status. The important thing is that we get that right. Because I think if we do that well, we can continue on this sort of one-way road towards sustaining the opening of the economy and, by next year hopefully, transitioning the virus from pandemic to endemic and dealing with it on an annual basis." Later in media rounds he said he had not seen plans for a firebreak lockdown. However, he stopped short of ruling the measure out altogether. He told BBC Breakfast, "The newspaper was reporting that they think there could be a possible lockdown. Look, vaccines have given us the ability to reduce infections, to save 100,000 lives. It is through the booster program that I hope we can transition the virus from pandemic to endemic status and deal with it year in, year out. It is going to be with us for many years, but not have to close down our economy or take the severe measures we had to sadly take in December of last year." Asked about the firebreak reports on LBC, Mr. Zahawi said, "I haven't seen any plans around this." A senior government scientist and member of SAGE reportedly told the paper that the UK is about to enter an extended peak of infections and hospitalizations that could force ministers to reintroduce restrictions over the school half-term next month. They said a full-scale lockdown would be a last resort and is unlikely to happen, but the government has drawn up contingency plans if the NHS becomes overwhelmed by a surge in serious COVID cases. Boris Johnson is said to be prepared to make mask wearing and social distancing mandatory in indoor spaces and public spaces. While the week-long October half-term break for schools could be doubled into November if hospitalizations fail to fall. The Prime Minister will also consider anything from a limit on indoor gatherings, travel restrictions and closing non-essential shops, it's claimed. The SAGE source said, "This is essentially the precautionary break that SAGE suggested last year. It would be sensible to have contingency plans, and if a lockdown is required, to time it so that it has minimal economic and societal impact. We are going to be at a peak, albeit an extended peak, quite soon, so it's not really the same situation as last year, when failure to reduce prevalence would have resulted in collapse of NHS and people dying in car parks. Hospitals might be overflowing before deaths reach the same level. Acting early will prevent this level." A total of 79.9% of adults in the UK are double jabbed, but hospitalizations have remained consistently over 900 a day for the past 2 weeks as winter nears. The COVID vaccines have been shown to give good protection against severe disease for at least 6 months, and there is also evidence of longer-lasting protection. But because any rise in cases would place pressure on the NHS, which is currently dealing with a record backlog of operations, there are plans in place for booster jabs this winter. The rollout is expected to begin this month, with ministers awaiting advice from the JCVI on who should be prioritized. Source: metro.co.uk. Please like, share and subscribe. Thank you for watching.